The human body changes in many noticeable ways with age. Often the first signs of aging involve the musculoskeletal system. By age 35, peak performance among superior athletes begins to decline. Sensory organs also begin to change early in midlife. A common development, for example, is presbyopia, in which the eye can no longer focus easily on close objects. By age 40 or so, many people find it difficult to read without using reading glasses or changing to bifocals. Another, if later, common development is presbycusis, or age-associated hearing loss, which initially attracts the ability to hear the highest pitches and gradually the lower pitches as well. Therefore, older people may find that violin music no longer sounds as exciting as it did when they were younger. Also, because most of the closed consonants of speech are high tones, sounds such as K, T, S, P, and older people may think that other factors are mumbling. In most people, the property of body fat increases by more than 30% by late age. The distribution of fat also changes. There is less fat under the skin and more in the abdominal area. Thus, skin becomes thinner, wrinkled, although sun exposure and smoking have a greater influence on wrinkling and more fragile, and the shape of the torso does change. Not surprisingly, most internal functions also decline with age. These functions generally peak shortly before age 30 and then begin a gradual but continuous decline. Even with the decline, however, most functions remain adequate throughout life because most organs have considerably more functional capacity than the body needs functional reserve. For example, even if half the liver is destroyed, more than the liver tissue remains to maintain normal function. Disease, rather than normal aging, usually accounts for loss of function in old age. Even so, the decline in function means that older people are more likely to experience side effects from drugs, changes in the environment, toxins, and illness. Although the decline in function of many organs has little effect on how people live, the decline in some organs can greatly affect health and well-being. For example, although the amount of blood that the heart can pump at rest is not greatly reduced in old age, the heart cannot pump as much when pushed to its maximum. This means that older athletes will not be able to perform as well as younger athletes. Changes in kidney function can dramatically affect how well older people are able to eliminate certain drugs from their body. Determining which changes are purely age-associated and which are the result of how a person has lived is often difficult. A sedentary lifestyle, poor diet, cigarette smoking, and alcohol and drug abuse can damage many organs over time, often more so than aging alone. People who have been exposed to toxins may experience a more significant or more rapid decline in the function of some organs, especially the kidneys, lungs, and liver. People who worked in loud environments are likely to lose more of their hearing. Some decline in function can be prevented by adopting a healthier lifestyle. For example, stopping smoking at any age, even in one's 80s, helps improve lung function, decrease the chance of developing lung cancer, and decrease the risk of heart disease. Weight-bearing exercise helps maintain muscle and bone strength, regardless of age, and helps prevent falls and debilitation. Gerontology is the study of aging. Geriatrics is the branch of medicine that specializes in the care of older people. A number of disorders occur almost exclusively in older people and are sometimes called geriatric syndromes or geriatric diseases. Other disorders that affect people at all ages may cause different symptoms or complications in older people. For example, an underactive thyroid gland usually causes younger people to gain weight and feel sluggish, whereas in older people it may initially or predominantly cause a state of confusion. An overactive thyroid usually causes younger people to become agitated and lose weight in older people. It may cause them to become sleepy, withdrawn, depressed, and confused. Depression usually causes younger adults to become tearful, withdrawn, and noticeably unhappy. In older people, depression sometimes causes confusion, loss of memory, and apathy without a sense of sadness. The confusion that results from these conditions is often mistaken for dementia in older people. Acute illnesses that were once likely to result in death for older people, such as heart attacks, hip fractures, and pneumonia, are now more often operable and controllable.